this is Shanna Dethi at the Digital Health Live Studio at CES 2019. Today I have the privilege of speaking with Stephen Falowski, Dr. Stephen Falowski, correct? And he is the Secretary of NANS. Steve, you want to tell me a little bit what NANS does?
Absolutely. Well, thank you for having us here at the CES. We're the North American Neuromodulation Society. So what that is we're a society that revolves around neuromodulation or implantable devices on the brain, the spinal cord, nerves in the body to treat many ailments, anything from Parkinson's disease to chronic pain. Specifically, we're here today talking about the answer to the opioid crisis, as we do a really good job of treating chronic pain in this country with our devices. The job as a society that we have is to try to bridge the gap between the medical device companies and the physicians and the patients, and to try to be able to get these therapies out to the community, out to the patients, educate the physicians and the patients so that they are aware that these therapies exist.
Right, so you said implantable device, correct? So
Correct.
this is something that's surgically put into one's body. Is this done outpatient, inpatient?
That is a great question. We do have implantable as well as external and wearable devices. Most commonly, we do use implantable devices. These are minimally invasive procedures. Can take sometimes as little as 20 minutes where the patient goes home the same day. They can be put in through needle pokes, the same way an IV or a flu shot is received. So these are very safe and effective procedures, minimally invasive for the ones that are implanted. But we do also have wearable technology as well as external devices that treat many different other diagnoses as well.
Is there a type of chronic pain that you see that these devices work the best on, or does it work on all types of chronic pain? You know, back versus leg versus feet?
Wonderful question. Most commonly, and for almost now 50 years, spinal cord stimulation has been used to treat what we consider post-surgery pain, or pain that comes on after a spinal surgery. And for the longest time, that's been our most common indication. But there are others that we also treat, things like diabetic neuropathy of the hands and feet, as well as trauma to a nerve that you can have. We have neural interfaces for people with prosthetic limbs as well. So there's many different indications for chronic pain we can use it for, and it's just continuing to grow and grow the further indications we can use it for.
Okay, so how can people find out more about NANS and the work that you're doing for us?
So we do have a website, www.neuromodulation.org. That is the website for NANS. But you can also just even Google spinal cord stimulation or neuromodulation, and these therapies will come up. There's many device manufacturers that are coming to market at this point, as well as some of the major global medical device companies.
Great, well thank you so much for your time today.
Well, thank you for having me.
And this is Shanna Dethi live from the Digital Health Studio at CES 2019, hosted by Living in Digital Times.